Hello, I'm Dr. Debojyoti Sarkar. I practice surgery in Delhi and Gurgaon, and one of the most important and most frequent conditions which I encounter in my practice is the tightness of the foreskin in males, mostly in the middle-aged group, and so I want to discuss about circumcision. Circumcision is a surgical procedure, and circumcision is the removal of the foreskin when the glans penis becomes exposed after the surgery till the groove. So we want to discuss that when we are doing circumcision, there are three major conditions. One, it is the ritual circumcision which the Jews they do at birth. The Muslim people they do in childhood, in their children, and in adults and children it is often required apart from the ritual circumcision. There are a few conditions. The prepuce becomes often very tight in children. When there is it becomes very painful to retract the foreskin, as a result of which the urine does not flow properly. There is backflow of the urine, and there is lot of sedimentation and infection of the glands below the skin, and it causes lot of trouble to the young children. So the mothers must be aware that the foreskin must come back up till the groove so that the glans is cleaned properly. And also in adults, circumcision is required for a condition known as balanoposthitis or phimosis. It is one of the most common first presenting sign of people having uncontrolled diabetes. If you don't know, if you are not diagnosed, often people present with chronic balanoposthitis, that is infection and unable to retract the foreskin, or the foreskin is extremely painful on retraction. Circumcision is required for mainly two things: the area below the foreskin which covers the glans, the area has to be cleaned. It cannot be cleaned if the foreskin is not being able to retract, because then sediments will get deposited, and when the prepuce gets very tight, then there is also a backflow of the urine which can cause urinary infection. It can cause infection below the skin of the glands. And secondly, the foreskin often gets infected and tight in uncontrolled diabetes. Range of complications can even go up to causing cancerous situations, but that is very rare. So I would always advise not to get misguided by the information given in the internet or just by other rumors. Yes, it is an issue which needs to be addressed, but it is not to be something to be very scared of, and circumcision is a very simple and effective procedure for this. The surgery is not a major surgery. It is a daycare procedure. It can be done under local anesthesia in adults. In children, yes, it can be done if the children cooperate, but often they don't, so a very short general anesthesia is sufficient. It's a daycare procedure. You are allowed to have your food and water immediately after surgery, and surgery can be done in the conventional route and by open a normal conventional method, by a laser technique, by stapler technique. The laser and the stapler, as in my previous conversation I have told that the principle of surgery has never changed and is not going to change. Only thing is, these devices are there to give you more comfort, to cause less bleeding and to cause less complication. So there is less chance of infection, there is less chance of bleeding, and the procedure is comfortable if you do it by a stapler surgery. But yes, all the methods the crux is to get the foreskin removed. Often people ask what are the complications of surgery. As such, there is no complication of this surgery. You should always maintain hygiene. You should definitely take care so that you don't soil your dressing by the urine. We do the dressing in a way that it should not be soiled. If you bend forward and you pass urine carefully. And third, a minimum amount of bleeding or a minimum infection. These are the complications, which is not a routine. Very rarely it happens. So it is normally a comfortable procedure, and you are definitely discharged the same day without any consequences.